drawing your attention also to the fact that there are virtually no pediatric specialists for chronic diseases in Northeastern. So when children get ill, they will be housed in downstate and other hospitals. So please, stay out of Thank you. Joe Odell. Joe Odell.
Good afternoon. My name is Joe Odell. I'm the father of 4 girls, one of them which is in malpractice schools. The past 10 days, I've been thinking to myself, how in 180 seconds can I make this peacock possibly change her mind? It's a daunting task because in her heart, she believes that she is 100% right, and all the people, or most of the people in this room, are wrong. That numerous school boards in these 4 counties are wrong, and that I am wrong. And it's not just a difference of opinion. If it was, she would say, well, the duly elected school boards have spoken. Let's just see how this plays out. But she didn't do that. When you heard that the school boards went against the recommendations provided by the CDC, you felt you must intervene. When 4 of 8 county commissioners felt compelled to write you a public letter emphatically telling you that you've overstepped your boundaries, that you should rescind your order, you ignored those words. I have a PhD in adolescent development from Michigan State University with a minor in statistics. This means that I am trained in research methodology and I'm able to distinguish between good and bad research. When I speak to schools all over this country, school officials respect my perspective and my experience. And yet, when I step in front of you, I feel that you have already dismissed me, dismissed most of us, and believe that you know better unequivocally. Let me begin with a few facts. According to CDC, the survival rate of children under the age of 19 who get COVID and die, or survive, is 99.998. If you don't understand that, that means 2 out of every 1 million children who get this will die. The CDC recently found that 80% of Americans have some sort of immunity to COVID virus. There has not been one definitive study with random assignment and control groups that prove that wearing masks statistically significantly reduces that risk, or they're more likely to die because they're not wearing those masks. So Dennis, who was here earlier, this virus is not polio. The reason we know that is because it's not affecting the kids like it was with polio. And whatever it was in 1953, they started to make sure every child was vaccinated because they knew that was the right thing to do and it was the best thing to do. This to me is called Life 101. You must begin to understand that we have human responsibility. By now, every person in this room knows the risk, and whether they get it at Meyer or whether they get it at school, it is not your fault. It has not been your responsibility. Okay, go ahead. Thank you.
Hey, kiddo. Hey. My name is Jennifer Thompson. I'm going to speak in the microphone. microphone so everybody can hear. I represent Galen High School, Galen Community Schools, Otsego County. And I am FaceTiming my son and 22 other students who refuse. Regarding what they felt they should do in the best interest. They decided not to wear a mask. So they went to school, they were able to get into the school, and they were asked to put their masks on. They refused to put their masks on. They were asked to be sent home, and they said, we respectfully decline. We have a right to an education, and that online education is not best for everybody. Because of that, they are now sequestered in the auditorium because there's 22 of them, and the numbers are growing. And I understand that everyone keeps saying, you know, what's going to end up happening is if enough students don't wear masks and this keeps going, there's not going to be school. Yep. Well, guess what? Maybe that will force the hand to make the decision that the parents get the choice, that it's in their best decision to decide what's best for their child. Woo! And everybody who's watching this, I encourage all school districts to get on board. If enough students stand up, if enough students don't go to school, if enough students refuse to go home, even when they are sent home because they have to do the online school, they're going to come back day after day after day until something happens. Yes. It is our right as parents, and these kids are standing up for themselves, and we are standing up to support them. So that's ultimately what might end up happening because you're not understanding the petition and the position that we're taking. So, I encourage all school districts who are mandated to mask to get on board. If your students go to school and they cannot get in with the mask, figure out what you can do to show to the people in charge that are making these decisions for us that this is what's going to happen. So, I wanted to thank my son and all the other students. And if we have to force the hand to do what's best for our families and our children, we will. Thank you.
If this was really about safety, wouldn't we be talking about the N95 mask being All right. So if this was really about safety, wouldn't we be talking about the N95 mask and that cloth masks and 5-cent masks?
Right.
What happened to my body, my choice, or is that only applicable for abortion?
Yeah.
Do you know what it's called when you force a child to wear a mask in fear of a virus that poses almost no threat to them?
Child abuse.
It's called child abuse.
Yeah.
You want to look up a disease? Look up Munchausen by proxy, because that's exactly what this is. Now, if you think I'm exaggerating, then how would you respond to a parent that's forced his kid to wear a football helmet in fear of falling coconuts and boulders from the sky? Your child is almost as likely to die from COVID than he is a rock falling from the sky. And yet, you saw that and you'd say the parent was abusive and he forced his kid to participate in this utterly insane charade to satisfy his delusional, psychotic hypochondria. Now, do any of you know the psychological damage we do to these children, asking them to cover their faces? Teaching them the air is toxic and everybody around them sick? Have you ever wondered? How about the health effects of having them breathe through the spit-soaked rags every single day? What about learning to read? The kid can't even see the teacher enunciating his words. What does it do to a child's developing immune system if he has to wear a mask all day, every day? The fact is, you're satisfied
to place this burden on the children anyway. And why? It's not to keep them safe. They're already safe. It's not to keep the adults safe. They can get vaccinated if they want. But you do it to make yourselves feel better and protect yourselves politically.
Right.
That's right. The child's mask is a symbolic security blanket for you, not them. It's a disgrace and y'all should be ashamed.
Yeah.
And let me let you in on a little inside joke that I have. The attorney that was here earlier, masked up, that spoke so eloquently, she was at a party with 300 people. And she was called out at the last board meeting. She wouldn't say a thing after that. But she was unmasked. So were their children. This is ridiculous. Y'all should be ashamed of yourselves.
Resign!
Resign!
Kate Bowman. My name is Kate Bowman. I'm a mother of 5 children. I have 3 children in high school, 1 child in middle school, and 1 in elementary school in the Boyne City system, public school system. My eldest son is a state qualifying wrestler entering his senior year today, first day of school. Today he was ready to fight anyone forcing him to wear a mask. I had to tell him to stand down because I would fight for him. That's why I'm here today.
Amen.
I had to tell my 9-year-old to remove her mask during morning recess today. I told her to breathe the fresh air as long as you can. Words a mother should never have to say.
Right.
Telling my children that they cannot breathe oxygen unhindered is as unthinkable as telling them they cannot drink water or go to the bathroom during school days. We are at a point in the pandemic where people have either had COVID, they've been vaccinated, or they've been offered the vaccine. It is time to get back to normal.
Yes.
It should be the parents' choice whether our children wear a mask and whether we succumb to the fear. My husband is an entrepreneur starting and maintaining 2 businesses in Charlevoix County. During the early years of starting those businesses with a young family, we were greatly helped by the WIC program that was run by your department. As a young mother, I learned from your department how to feed my family healthfully and to build my children's immune systems. I will always be grateful to you for that. I think we could easily argue that building healthy immune systems is more effective than forcing masks on children. Last September, my family eliminated sugar and processed foods from our diet, among other things, to build our immune systems against illness. Several Boyne City students got COVID last year, but not my children. None of my 5 children. We had taken your advice from years past and we had built healthy immune systems. I could say that I don't feel safe sending my kids to school with children who are not fed a healthy diet or who do not have healthy immune systems. Would it be right to mandate a ban on sugar and processed foods? To check all the school lunches and throw away anything that fails to pass? Maybe go into people's pantries and make sure that only healthful foods are on the shelves.
Amen.
No, it would be wrong to impose such a mandate in the same way that it's wrong to mandate the wearing of masks. It takes away the freedoms that our veterans have bled and died for, and you have overreached into our personal lives. I nearly died at age 1 from a health department recommended pertussis vaccine. Health departments make mistakes because their members are only human. I believe you are making a mistake now, and as a mother, I plead for you to reverse your decision and on the mask mandate. Get back to helping people build healthy immune systems, not with mandates, but education programs like WIC. I wouldn't call myself anti-mask, I call myself pro-freedom, pro-getting our world back to normal for my children and the future generations. Please do not stand in the way of our freedoms or the progress we've already made against COVID and in bringing the world back to normal. Thank you.
Skip.
Skip.
Next.
Mary Moore,
Mary Moore.
Kevin.
Good afternoon. Have I got a timer?
Yes.
I was a high school debate champion, so I'm used to having a timer right in my face. After that, I went and got a double E degree. 5 years, I co-opted, so it took me 5 years. After that, I went and got a law degree at a very fancy school. And after that, I went to work for a very fancy law firm in Chicago. While I was there, I did a lot of patent infringement litigation. So while I'm not a doctor, I've worked with a lot of experts on complicated matters like microchip manufacturing. I worked on breast implant litigation. My firm worked on the HIV tainted blood. I worked on navigational systems in cars. I don't think I think I bring something to the table here. I'm used to looking at data. I'm used to working with experts. I'm used to evaluating expert testimony. Why am I here? I've got 3 kids. The youngest one is in school in Emmett. I pay taxes in Emmett. But really I'm here because I care about freedom, I care about liberty, I care about where this country is going. My oldest child just commissioned in the Marines. He's going to go risk his life. What is he risking his life for?
Exactly.
He is not risking his life so that a public health bureaucracy can run this country.
Right.
I really can't improve on a lot of things that were said here today. Almost every one of my points, somebody made it, including this isn't polio. Or we're not really talking about safety here because masks don't work. And here are all the studies that say they don't work. I have sympathy for asthma. I have some of that in my house. I have sympathy for chronic conditions. But frankly, the statistics bear out, and I have it on the authority of Dr. Jay Bhattacharya out of Stanford, that the risks to children aged 0 to 19 are 0 to negligible. These kids are not getting sick, they're not transmitting, they're not dying from COVID. There is no reason to mask them. Now, let me just say, what I want to say is, if I was in court or if I was in a debate round, I'm going to tell you the positions I would feel comfortable defending with my background, okay? I feel like that's what I have to offer to you guys today. I would like to defend the proposition that there is no protection offered by these masks, none. My husband did bioweapons work, okay? You got to wear an N95 properly, or you got to wear an N100 properly, even to paint under OSHA standards. Okay, these masks these people are wearing at school do nothing for a virus. Okay, number 2, what else would I defend? I would defend the proposition that to people who are under 70 years old with no comorbidities, COVID poses no more of a threat than the flu. And so we are being hypocrites if we're going to mask all these people, for something that has less of a threat to people than the flu. May I go on, or do I need to quit? Cases have been inflated by improper use of the PCR test. Deaths have been inflated by payments to hospitals to call conditions and deaths COVID. Deaths have been caused in at least New York and Michigan by governors' policies. Deaths have been caused in hospitals by protocols. Deaths have been caused by the refusal to treat people early with ivermectin and HDNW. Okay, deaths are not caused by asymptomatic spread. If masks and vaccines work, why are we even all here talking about this? The Constitution does not guarantee that we live a life without risk. What is my son risking his life for?
I'm a mom of 4, and my children go to Ellsworth. My oldest just graduated last year through the midst of all of this, her senior year, in a mask. I just want to point out one thing and then ask you guys a couple questions. I know you can't reply because you're not allowed, so I just want you to think about the answers. One, the ones that are wearing their masks, I've seen you adjust your mask probably 47 times today. So now I want you to go back and look at our children. Pre-COVID, how many of you have children in the school system that are on the spectrum, that have Asperger's, that are autistic, that have ADD, ADHD, ODD, any of the mental illnesses? How many of you guys? Us? Okay, now pre-COVID, imagining trying to not have them a distraction. Now put a mask on them. Now you're telling Jimmy, Johnny, Susie, and Billy to not play with their mask, but you're also distracting the rest of the class. But now that child that's on the spectrum has a routine that they follow. They're routine kids, right? They have to follow a routine. That's what they know. Now, go into a school where you have the masks on after COVID. How many times is a teacher stopping your kids from getting an education to tell Jimmy, Johnny, Susie, or Billy to not play with their mask? To not slap them in the face with it. My son is 9 years old in 4th grade. He is not on the spectrum. But I know many parents that have their children on the spectrum that are trying to teach their kids, okay, now you have to put a mask on. That's not a routine. That's not part of the routine at all. And if anybody knows anybody that has a kid on a spectrum, like I said, it's routine. And for me, that's not okay. My 4th grader, like I said, he's not on the spectrum. He has asthma. He has an inhaler. I had to tell the school he will carry his inhaler on him because he needs it. His masks, he can't breathe in his mask. He needs his inhaler. Well, he can't carry his inhaler. No, he will carry his inhaler. And I hope everyone, you parents, enforce that for any kid that's not allowed to carry an inhaler, but they have to wear a mask.
Yeah.
How many of you come home and, oh, your inhaler's missing because the teacher wouldn't let you have it? I have to pay for it. I have to pay for that inhaler. I don't know how many other people have to pay for that inhaler, but they're not cheap. Not one bit.
$490.
Yeah, $150 a pop, that's with no insurance. That doesn't include the EpiPens that the kids have to have. So I guess my biggest thing is I want you guys to look at the parents that now have to reteach their children on the spectrum how to keep that mask on and not be that distraction in class. How to follow the rules, even more rules that they have to follow. Parents, stand up for your kids because some of them can't stand up for themselves.
That concludes the pre-registered individuals who asked to speak today. I did have a request for one individual who does not wish to identify them that asked about being able to speak. If you have not spoken and you did not get signed up and you would like to speak, your opportunity is now. Can you come over here, please?
Cindy Banner, Shelbyville County, also a healthcare professional. I am here today to voice my opposition to public order issued on June 27/21. I believe it's an overreach of an authority, and nothing in this public order substantiates an imminent danger to the health or lives in the area served by Health Department in Northwest Michigan. The only data which is necessary for this order to be issued. The only data Ms. Peacock provided is that from 8/3 to 8/27, the Health Department of Northwest Michigan reported 536 cases of COVID-19 and 9 deaths compared to 102 cases in July. She failed to report the number of cases in August are well below other months. April, 1,802. March, 1,056. January, 605. December, 969. November, 1,793. Ms. Peacock uses no data to substantiate the statement she utilizes in the public order. Instead, she uses generic phrases. have reported the likelihood, recommended, it is likely, available evidence are estimated. Nothing here is factual or evidence-based.
That's right.
The public order also states significant and factual findings include, quote, local hospital authorities have reported a dangerous strain on capacity included limited ICU beds. However, according to the data provided on Michigan Gov on 9/3/2021, McLaren capacity has 9 COVID patients and 2 COVID patients in ICU. Munson Healthcare Charlevoix Hospital, 3 COVID patients with no COVID patients in ICU, and Otsego Memorial Hospital, 5 COVID patients and 4 COVID patients in ICU. I took that data from the Michigan government and other from this health department. Our region, number 7, which is 14 counties, there is 0 hospitalized pediatric confirmed positive. That's for 14 counties, not just our 4. I believe our health officer, Lisa Peacock, has a lot to answer for. After 18 months and thousands of dollars spent, we're doing the exact same thing as we did last school year. Masking and quarantines, despite people being vaccinated, herd immunity, and advancements in medical treatment for COVID. Clearly someone is not doing their job as Peacock. What you're doing is an overreach of power and violating our constitutional rights. With no accountability, no criteria to base your decisions on, and no data to support imminent danger and issue a public health order. Your public order is not warranted and should be rescinded.
And I've been there for 45 years. My family's been going since 1830. First of all, I want to address the lawyer here. Walking in with her, she didn't even know me, but being from the peanut gallery, she ordered me to take her glass and put it inside. Didn't even ask please or thank you. And then she came out of the bathroom and said, well, what'd you do with my glass? I mean, that's ordinary. Come on, help me understand this. But most of all, I've been a type 1 diabetic since 1967. I'm 70 years old, and I've never worn a mask. I'm not going to wear a mask because guess what? It's against my constitutional right. My dad fought in World War II, and I'm the chairperson for the Boyne City Veterans Memorial. And these vets gave up their right to go to war for what? The health department to dictate what they're going to do.
Right.
What about these guys here? What about us as parents, grandparents, and so on and so forth? And so I'm here to say, let's get real, folks. You know, this isn't a game. This is our life. Thank you.
When my kids go to Gaylord, I hear a lot of talk back and forth about the masks. But when I hear it, all I can think about is what my family went through all the way up until 1983. Most adult members of my family lived through the assimilation schools that people like all of you put on. Destroy the Indian and save the person. Mask Up Michigan sounds very familiar. It scares me to have to live through this again and put my daughters through what we already survived once. I hear our body, our choice from people that are willing to kill babies. And I understand that there are situations, but that's why a one rule to fit all does not work. Not everybody is a cookie cutter. You're different from you, you're different from you, you're different from you. I'm different from her. The point being here is to say that everybody is exactly the same is ludicrous. We've lived through all of these things before, and the one thing we've learned is that a region knows what works for itself best. That's why our schools worked so hard to create a plan that fit everybody. We aren't saying to simply unmask everybody. We're saying that what about little Timmy that can't hear? He can't just learn how to sign language. Maybe he has a hard time with sign language. These kids sometimes have to see the face of a person to understand them. That's where plans and local communities work well. We understand the risks. We understand what's going on. We're not ignorant. We're not some conspiracy theorist nuts. We just understand what works for us. And for someone to come in and ignore our people that we elected and simply state, I don't like what you guys did, here's my idea. And then to not even bother talking to them about it. In the real world, you can't just do that. So, I'm sorry, but just a small guy in the middle of the woods here. I do what's best for my kids. And if my kids feel like their teachers are torturing them every day, they're not going to go to school. They're not going to get to learn. That's going to affect them for the rest of their lives. And you're a great role model for that.
Hello, my name is Justin Stubbs. Just a guy in the county. I'm a founding member of the Young Master Schools Group. We have about 640 members. Speaking for myself, I'm a professional. This is my view alone. But the path of mandates are a slippery slope. When the people in power force others below them to make changes to their body's natural way of functioning, immune system response, or any part of their anatomy, it raises the question of when will the mandate stop? First it's a mask, then it's a shot with unknown long-term safety implications that was rushed to market, and then maybe some kind of passport to function in society. If I don't stand up for the least of us, our children, and our free will to choose what happens to our bodies, the only thing we own that we really have control over in life, then how soon do our other freedoms fall into the never-ending condition of free will suspended for the greater good? Also, as a side note, yes, some people could pull their kids and enroll them in a different school or homeschool or the like. But don't play coy with me, because you fully understand that there's a very large percentage of families who either can't afford to, don't have the skills to, or simply cannot set aside time from their jobs to instruct their children on their own. Single parents and two-income households have been dependent on the state for years to give their children a quality education without being politicized by an out-of-touch federal government entity controlling local community decisions. What is good for Detroit, D.C., or California is very different than acute application in Little Petoskey or the surrounding community. Right. Much like shop local, you need to teach local and use common sense rules for our specific community conditions, not vague generalizations from an unvettable federal agency on the other side of the country. Sometimes it's truly a case of the people who sell the panic sell the pill. That's right. I'd like to read a quote from you. It's a guy I admire. It's from a few years ago, probably the 1800s, but if men are to be precluded from offering their sentiment on a matter which may involve the most serious and alarming consequences that can invite the consideration of mankind, reason is of no use to us. The freedom of speech may be taken away, and dumb and silent we may be led like sheep to the slaughter. That guy was George Washington, first president. And I think you've underestimated your target audience. You think we're sheep. We're lions. You've angered the pride.
He's ADHD, ODD, he has insomnia, and some sleep apnea. He can't breathe. And he spent more time getting in trouble for having it under his nose than he did in the classroom. We're asking you to let us make the choices for our children. You've heard the statistics. That's all I got. Just let us make our own decisions. We can go to the doctor and make our decisions. I made the decision to take my son off of all the medications. That was my right. We just want that right.
watching us all. I don't want my grandkids to sit there and just have people scared like this. Do you not have a heart? Do you not understand what it's doing to our children? My 8-year-old granddaughter said the other day, I said, honey, how do you, they're going to be homeschooled because of this rule. And she just breaks my heart because we love them so much. Well, I said to her, well, honey, how do you like wearing the mask? She says, Grandma, I hate it. I can't breathe. I put it below my nose and my teacher looks at me. And I said, well, take the damn thing off and smile at your teacher because it's wrong.
That's right.
I'm shaking like a leaf and you don't even have an expression. It blows me away. Please do something for our children. My 7-year-old grandson, same thing. He can't breathe. His is full of snot. I mean, he sat there for 3-4 hours. Expressionless. Your eyes smile.
They've
Do
already
you
made
really
the
give a
decision.
shit about any of us?
No.
Do you?
Wait, get
Think
this
about,
over with.
I mean, look at y'all looking at me right now.
All eyes.
It makes me feel, it makes me so sad, you guys. Do something for our children, please. And still no expression.
Do we have any
Oh.
public comment from the assembly outside of the room that didn't have an opportunity to address?
We're all set out here.
Thank you.
We made our point.
All right, so we have gotten through in-person public comment. In-person public comment is now closed. However, as we have practiced during the pandemic, we have allowed for Zoom participation. And so it looks like we have 245 participants, 99 plus that have indicated chat. We are, because of the Open Meetings Act, we cannot limit a time for public comment. We can limit the amount of time each participant is allowed. Therefore, this body will take I'm going to ask if this is appropriate before a 30-minute break. Is that enough for everybody to take for a lunch period?
If we're going to do that, Madam Chairperson, I would ask that we amend our agenda so that we can immediately go to the discussion of this order and put aside the staff reports and the written reports. So that, I mean, this is the topic, let's cover it now. I'm going
Sir,
to
I
make,
have 246 individuals that have a right to speak prior to our meeting.
I understand that. I'm saying that once those folks have had a
Once we're
chance to
done with
vote.
public comment, we will address the agenda.
Thank you.
Half hour? Agreeable for everyone?
Madam Chairman, are you saying that we still have 200 people to speak on Zoom?
I have 246 participants that have the opportunity to speak if they so choose. And we do have.
They're watching it, it doesn't mean they want to speak.
I still
You just don't wanna
have
move
to
the meeting
go
along.
through the participants and ask if they choose.
I think we take a 10-minute recess for bathroom breaks and continue on. Half an hour is too extensive in this case.
You've heard enough. I'm-
I'd be kind of in favor of a shorter break, 15 minutes.
I would agree with that.
Yes.
Is that the table?
10 minutes.
10 minutes is good.
Let's do 15, we'll have a 15-minute recess, and then we will take online comment for those who have not already spoken.